Hello again. So I said earlier that I would share some of my thoughts on kind of processing anxious thoughts, processing things that are going on in your head in the run up to an appointment. And again, this is something that I'll often talk about with anxious dental patients. And so I'm putting some of what I preach into my own experience and my own preparations for the septoplasty that I'm about to go in for in a couple of days. So I think probably the first thing to mention is in anything like this that you're doing, and the patients I see, there's always motivation. So there's always a goal, there's always a reason for the person wanting to come in for the dental treatment. It's quite rare for a phobic patient to come in after decades of feeling anxious and worried about dental treatment to suddenly turn up and say, I've just decided to come in to get this done. So there's usually a motivation, and often it boils down to one or a combination of three things. It's either that the patient's starting to have pain, they're maybe reached a point where the aesthetics and appearance of their teeth is becoming upsetting and overwhelming, and they want to do something about the appearance. And that's occasionally there's an event, a wedding coming up, or they're looking at getting a job, or they're hoping to get a partner, a life partner sometimes, and wanting to do something about the appearance of the teeth. And again, occasionally it's just down to eating. There's problems with function, they're not able to eat properly. Those are the three most common kind of motivational factors for a phobic dental patient to kind of make the decision after X number of years, I now want to do this. So motivation to any kind of procedure is really important. It's probably one of the reasons why it's quite difficult working with kids, because kids' motivation to have treatment is harder because their only motivation is going to be if they're in active pain. Usually it's quite hard to have a preventative motivation of let's do this now so that you don't have problems later. When you've got a 5 or 6 year old, that's really, really hard for them to comprehend because they're just in the moment rather than able to contemplate the future. So that's an interesting thought that I had about my own journey and where I'm at. So, when I was 17 and, there were a couple of failed or a couple of cancelled bookings for getting this procedure done, my motivation wasn't hugely strong then to kind of pursue it, because the only motivation I really had at that time was to do with cosmetics. It was to do with how it looked. And when that motivation was slightly diminished, and I wouldn't say I was terrified or phobic about going to get it done, but I just didn't really relish the prospect of having a general anaesthetic and surgery. So when my motivation came down a little bit, and the priority of getting it done for cosmetic reasons came down a little bit, I never really felt that urge then to pursue it. So the difference in my life now, of course, is the health side of it. So the motivation is I'm now finding it harder to breathe, very blocked in the nostrils, so I'm finding it hard I often mouth breathe during the night, so I'm snoring. I'm finding it harder wearing PPE, having to mouth breathe, dry throat, headaches, that type of thing. So I think in anything like this, motivation is really, really important, so that when anxious thoughts start to come about, because of course they do, going in for a surgical procedure, there's going to be anxious thoughts, but the motivation helps to kind of counterbalance that a little bit, and focusing on the reasons why I'm wanting to do this actually helps to wash away some of the anxious thoughts that are there, if that makes sense. Because if I didn't have the breathing issue, that motivation wouldn't be there to do it, and of course I wouldn't then go and do it just for the cosmetic element of it. So that's a big part of this for myself, and of course it's different for every person. So every dental patient I meet, part of that journey and part of that working together that's really important is finding out the specific motivators that are there for that individual patient. And I can't second guess them. I can't create those motivations for the patient. I need to learn what they are so I can then utilize that as part of the therapy as we move forward. So hopefully that makes sense. So I've been focusing on my own motivation as in my thought processing, so that when anxious thoughts come about, I'm able to remind myself as to why, what is my motivation, why am I doing this. Now I see when anxious thoughts come about, because even the highest skilled master practitioner of hypnosis or NLP or any kind of psychotherapy in the world, or psychologist, psychiatrist. We are human beings, so we have the capability of a range of emotions, and that range of emotions includes anxiety. So I have had anxious thoughts about going in for this procedure. Of course I have. But what's interesting in understanding the psychology of rumination and of anxious thoughts is remembering something that I learned from the psychologist and hypnotist Michael Gow. This understanding, and he teaches this with managing depression, and he talks about you would believe somebody who has high self-esteem wouldn't have critical inner thoughts because they seem to have high self-esteem, and he talks about actually they do, and people with low self-esteem are surprised to hear this. They're surprised to hear that the person with high self-esteem actually has the inner critic and they have critical thoughts. Because actually the difference between the two people, the low self-esteem and the high self-esteem, isn't whether they have those inner critical thoughts and dialogue. The difference is whether they believe them, okay, and whether they're uncritical of those thoughts and they accept them as fact, or whether they challenge them or recognize them just for being what they are. Thoughts that will pass through everybody's minds and can be let go if there's no truth to them, or if there's little truth to them. So part of this process for me is actually an understanding that that is also true for anxiety and for rumination before a procedure like this, that I'm going to have a range of thoughts, some of which are going to be useful and some of them that are not going to be useful. So the useful thoughts are the ones that I will use, and they may produce a bit of anxiety. That's okay, and it's okay to feel anxious. That's important to say as well. Anxiety sometimes helps you to focus and to prepare and to be ready. Certainly as a student, if I didn't have anxiety in the run-up to a big exam, I wouldn't have the driver then to get my head down and study. So you needed that anxiety to help you study. But even as a student, I discovered that I would be anxious in the run-up to an exam, but actually the moment just before I went through the door to sit the exam, the anxiety disappeared, because I could recognize, even before I learned anything to do with hypnosis and psychology, that at that point there was no value to feeling anxious. What's the point of standing outside the exam room feeling anxious? That anxiety is not going to assist me. I'm not going to study. I'm not going to learn anything. All that's going to do is hinder me. So I've got, the anxiety I've got just now is helping me prepare. It's helping me to focus, because I'm the only anxiety I'm really allowing in are the useful thoughts, the preparatory thoughts, the thinking about, right, I need to have this ready. I need to make sure I ask these questions. I need to make sure this paperwork is sorted out. I need to get my bag ready. There's a few things I need to be in order and in place, because I'm planning to do very little next week and just recuperate. So that's the type of thoughts that I'm letting in and that I'm believing and accepting. Now, the thoughts that I am doing and I say doing my best, because sometimes they will linger, even for me, a little bit longer than I would want. But the thoughts that are unuseful or perhaps untrue are the ones that I am able to bounce. I'm able to rationalize and understand that these thoughts are going to enter my head, but they may not be true. Okay, so for example, one of the I think as a dentist, we spend our careers and it's drummed into us at dental school about general anaesthetics being dangerous. Don't refer kids for general anaesthetic. There's a risk, there's a danger. So the prospect of going for a general anaesthetic for me creates some anxiety, because I know there's risk involved. So that's an interesting side of it as well, this risk element. But I also remember back to dental school when the anaesthetists would be talking about this with the parents of the kids, saying, that there's a textbook risk of general anaesthetic, of the risk of death being 1 in 100,000. And you think, well, I don't, that's still a statistic, that's still a number, and the anxious mind will grasp onto the number one, not the 99,999. But I remember that some of these anaesthetists, and they would say, it's 1 in 100,000 risk of the general anaesthetic, but actually you were a 1 in 50,000 risk of being in a serious car accident or a fatal car accident, or being run over on the way to this appointment. So now you've done the dangerous bit, we should do the general anaesthetic. And that's how they would rationalise that. So as far as that part of my brain that has the fear and the anxiety about the general anaesthetic itself, I remind myself of what the anaesthetist would say back in the dental school, and also remember that fear and that anxiety that creeps in, which is natural and it's okay, and I'm accepting of it, is a natural thing. It is an okay thing to have a mild degree of anxiety about, but it's such a tiny, small risk. It certainly should not be something that is driving huge anxiety or preventing me from being able to go ahead and having the procedure that I want. Because actually both of these things are driven by the same thing, a desire for better health. Most phobias and most strong fears or anxieties boil down to a fear of coming to harm or death, essentially. So it's a kind of health phobia, health fear. My motivation for going through with this is also health. So recognizing that both parts of that emotion both have the same goal. They both want me to be healthier and to be safe. It is an interesting concept as well. So I'm very much focused on, I'm doing this because I want to breathe better. I know that if I don't, my breathing is going to continue to deteriorate. Being able to rationalize and tell the difference between these useful thoughts and things that might create a little bit of anxiety, but actually they're things that I need to think about and prepare over. And separating them from the ruminating and the anxiety about the risks involved with the anaesthetic. The other things obviously that would pass through somebody's mind would be the concerns or the worries about the post-procedural pain, that type of thing. But ultimately, I'm going to heal. I'm going to recover. I'm going to get over this procedure. There may or may not be swelling. There may or may not be pain, but ultimately, I will just need to manage that in the moment, and having an anxiety or a fear about that beforehand and now isn't going to change that. It makes zero difference to that, because the fear and the anxiety, I guess, would be trying to act as a protective thing by stopping me from going ahead with it, to stop me from having to feel that pain. But remember, my motivation is I want to be healthier. Okay, so if my motivation to be healthier is stronger than that fear, it becomes all the easier. And if it's painful, if it's swollen, if there's issues, I will manage that in the moment. There's no point being anxious about it. It's not going to change that from happening or not. So there we go. It's been another fairly lengthy video. I thought this would be a relatively short one, but it's been quite long. I will post again, but I thought that would be useful just to hear how I'm processing some of the knowledge that I have and some of the work that I do with anxious dental patients, and applying it to my own situation and my preparations now that I'm really just about a day and a half away from being admitted to hospital to get this procedure done. So again, to anybody that's watched this far and listened to my ramblings, thank you very much, and you'll hear again from me soon. Thanks.